Hi, my name is Jessica Miller, and I am a nurse with District Health Department number 10, and I work with our lead poisoning prevention program and grants for the state and CLIP regions, which is Childhood Lead Poisoning Prevention Program of Regions 2 and 3, which cover most of Northern Lower Peninsula. So today we're going to be reviewing and going over why lead poisoning is such an issue and ways that we can identify lead in the house and exposure, and how to prevent lead poisoning in your children. It is a #1 environmental health threat to children in the United States, and according to the CDC, 500,000 children ages 1 to 5 have unsafe lead levels in the U.S. Lead poisoning is 100% preventable just by doing some of the avenues that we're going to discuss further today. A little bit of history on lead poisoning throughout the times. Before 1970, lead exposure was defined as a blood lead level of 60 micrograms per deciliter. That had dropped down to 40 in 1971, and as of October of 2021, it is now down to 3.5 micrograms per deciliter after future studies and more studies on how lead poisoning can affect a child. And some of the symptoms of lead toxicity are abdominal colic, anemia, encephalopathy, and death. However, lead poisoning is often silent, as in there are no symptoms of your child being lead poisoned. And the reductions have occurred because blood lead levels as low as 10 were associated with adverse effects such as lower IQ and aggression in these children. So who is at risk? Essentially, everybody is at risk for lead poisoning. Children 6 months to 6 years are at the highest risk, and this is due to the hand-mouth action. They're more on the floor, less likely to be washing their hands. Also, children living in houses built before 1978. 1978 was the year that lead was banned in paint. And when I say paint, is for housing paint. It is unfortunately still in like paint for the roads and playground equipment because of its bright colors and sustainability. Pregnant women are at risk, children adopted from a foreign country, and refugee and immigrant children. And this is also because of FDA studies and things that aren't limited in some of those countries or monitored. So why are children at the greatest risk? As I kind of mentioned, they are on the floor, they're exploring the environment with their hands in their mouth, they're playing, they are putting their hands in their mouth, they're sucking on things, and children absorb and retain 50% more of lead they ingest than adults. So not only are they having a greater risk of exposure, they absorb more than what we would. And you might not visibly see like lead in your house because lead becomes dust from like peeling and chipping paint, and it can be present in soil, tracked into your house, and then it's in your carpets. So those crawling on the floor and sucking on things can make them at higher risk. So what happens to lead in the body? Lead is stored for long periods of time in mineralizing tissues such as teeth and bones. It can be released again into the bloodstream during times of bodily stress, such as pregnancy, breastfeeding, calcium deficiency, osteoporosis, so thinning of the bones. When you're pregnant, this will leach out of your bones and can affect the fetus. Same thing with breastfeeding because your body is under stress. So you are releasing that lead back into your bloodstream. Lead poisoning and the levels that it can be at. So as I mentioned earlier, it used to be that nothing was done at 60 or higher. Well, with recent studies, we have found that as low as 3.5, there's interference with brain development, such as IQ, hearing, and growth development. The brain connectors aren't joined properly, and the lead will break that, which then those connectors are never able to rejoin, causing lifelong issues with the children. Lead poisoning can also affect adults. So between 10 and 20, it's causing things such as like hypertension. We can see things as such as nerve problems, decreased ability to make red blood cells, kidney damage, anemia, coma, seizures. And adults, we're seeing decreased lifespan, all the way up to death if not caught and is too high. And as I had already mentioned, lead is often silent, so we're not seeing these levels visually. The effects of lead on the brain: most damage occurs in the brain with lead poisoning. It disrupts those growing connections, results in decreased intelligence, causes learning disabilities, creates those behavior problems. There was some testing done in some of our state prisons on lead levels, and it was very well linked and correlated that the prisoners at one time or currently did have high lead levels, which caused aggression and anger, and caused those outbursts to possibly lead to what put them in prison. So environmental lead exposure risks. You can have difficulties reading, school failure, delinquent behavior, renal disease, cardiovascular disease, hearing loss, and those are just some of the main causes from high lead exposure and being poisoned by lead. The list is endless. It goes on, and different things that can cause and have issues with. So how do you know if your child has been lead poisoned? As I've mentioned multiple times, most of the time you will not see, or the child will not act or look sick. The symptoms are vague and often mimic other illnesses, such as mild stomach upset, fatigue, hyperactivity, poor appetite, sleeping difficulties, which are all very common in young children with any symptoms. So really the only way to know if your child has been lead poisoned or is have higher levels of lead in their system is testing. The recommendations is that blood lead tests should be done at 12 and 24 months. That is for normal levels. So if the child's level is normal at 12 months, retest at 24. Why are the levels at 12 and 24? Because this is when they are greatest risk, because they are doing that hand-to-mouth activity and crawling, and they have now become on the move and more mobile. So for diagnosis of lead poisoning, it's done by a simple blood test. It can be done by a capillary or a venous draw. An elevated blood level greater of 3.5 micrograms per deciliter is defined as lead poisoning. And if that is done on a capillary result, then the child would need to have a venous draw done to confirm that, to make sure that it's not a false positive. If the venous draw comes back and is elevated, then a second venous blood test must be confirmed in 6 months. So we will repeat with this until we make sure that the level is back to normal. At this point, if continued to be elevated, follow up with a doctor and the health department. The health department will reach out. They'll be in contact with further education materials and helping monitor to help making sure that your child is safe and returning back to normal levels. So where do you get your children tested? Well child checks at a primary care provider or any clinics can do lead testing. They may not be able to do capillary testing at the office and may send you for a venous draw first. As I discussed before though, venous tests are the confirmatory tests, so it is the most accurate way of testing. You can also get your child tested at the WIC offices or your public local health department. Some ways to help reduce lead in your child's system and to help eliminate that lead. So The biggest thing is with lead, there is no medicine, there is no pill that is going to make your child better. The best way to eliminate lead and return to a normal level is healthy eating. So regular meals and snacks may help the lead from being absorbed, and making sure you're consuming the key nutrients that the body needs, so like calcium, iron, vitamin C. And make sure you're eating less fried foods and high fat foods, such as like chips and those leafy green vegetables, those lean meats, those orange milk, cheese, yogurt, those types of foods. So going a little bit further on where your child may be getting exposed to lead, and other sources. So lead-based paint, usually in homes built before 1978. Often the chipping and peeling paint is visible, such as these images in the windows, and kind of here in the bottom picture, this is like the soil outside where it has peeled off. Your biggest concern is going to be your high friction areas. High friction areas are going to be your windowsills, your doorways where things are opening and closing, rubbing that paint off and causing that dust that can be on the floor. Contaminated drinking water from old plumbing, bare soil, like around your buildings, because if it's falling off, gets mixed in with the soil, you might not be able to see it, but lead is in there. Making sure your surfaces are cleanable and cleaning supplies are available. Some other sources of lead, so like occupational, you're going to have like your manufacturing, construction, automotive repair, plumbing, electronics. So if someone in the household works in those industries and they're coming home with it on their clothes, they can be bringing it home. Hobbies such as making fishing sinkers, stained glass, pottery, reloading ammunition and firearms. Same thing, they can be introducing that into the house. Imports such as spices and herbs, food cans with lead soldered seams, lead glazed pottery, cosmetics, and then some of your home folk remedies from overseas and foreign countries. Other things to look for are like mini blinds, the old Tupperware containers that are like that avocado green and then orange and yellow have been tested to have lead in them, or your old painted toys. So these are all sources that could also be causing lead exposure in your house. So simple steps to protect your child from lead. So cover your bare dirt where your children play. So putting mulch down or some type of covering. Never sand, scrape, power wash, or sandblast paint unless you know it does not have lead in it. You're going to want to make sure you hire a contractor if there is lead in it that specializes in lead abatement removal. So in older homes, don't try to remove that paint yourself. One of the biggest things is knowing your child's blood level. So making sure they're getting this tested. You are your child's advocate, and you are the one that needs to make sure you're talking and bringing this up with, providers and healthcare providers, and making sure that they are getting these tests done. Making sure you know when your home was built to know if you're at risk for older paint. Assess places where your child spends time. Keep your home clean and dust free. Don't let your child chew on like painted surfaces. Such as like lower windowsills. Little kids like to kind of chew and suck on those lower windowsills, your cribs, things like that can sometimes contain lead. So simple steps to clean it up. So keeping your furniture away from painted or chipping peeling paint, because that can cause a high friction area. Washing your toys often, especially like your teething toys, washing hands, change out your work clothes or shoes, wash up or shower. So if you work in manufacturing and you have a shower at your work facility and you're able to change your clothes and have them do your laundry for them, that is going to be the greatest option. If not, designate an area at home where you get home, you strip down, you shower, and so you're not tracking that all through the house. Wash down painted surfaces on a regular basis. Don't use pots that are imported or cracked, and use cold water, not hot water, for like making infant formula. The biggest thing when you're cleaning is you're going to want to do what's called wet cleaning instead of like dusting. Wet cleaning is going to be like spray and a wet washcloth or paper towel. This collects the dirt, where if you're using a duster or a broom, it's just swirling the dirt back into the air for it to re-land on those surfaces that were just cleaned. These are some of the resources that we pulled from today for this presentation. Also some great resources for further education. And then some more lead resources continued. If you have further questions, you may reach out to me or Tanya Evils. Tanya Evils is our lead case manager, and she is the one that works with families directly in homes if lead is elevated. Here's my contact information and phone number too if you would like further information. Thank you.